would have guessed that lung cancer affects women differently than men, but it clearly does in all sorts of ways. Women, surprisingly, tend to do a little bit better than men if they have lung cancer, but the flip side of that is that when you look at all the patients who've never smoked and who come down with lung cancer, the majority of those are women. And in addition, the majority of those are young women. So for some reason, young women never smokers are more likely to have lung cancer than men. And we're just starting to explore that observation for the very first time.
What is the role that estrogen may play in all of this?
This is such a relatively new field that we're just starting to explore all those options. And so at this point we don't know, but it sure is a hypothesis for sure. And to support that hypothesis, one of the things we're starting to learn is that many lung cancer tumors or lung cancer cells have estrogen receptors on them, just like breast cancer cells have estrogen receptors. For lung cancer, it's a little different. They have a type of estrogen receptor called ER beta, whereas the majority of breast cancer cells are ER alpha. But boy, when you think about it, women have more estrogen than men, and if there's estrogen receptors on the lung tumor cells, that certainly suggests that perhaps estrogen is driving lung cancer in some people, just like estrogen drives breast cancer in some women.
You know, it's a very slippery slope when we talk about smoking and cancer, because one, obviously, it's a huge issue and a major cause of lung cancer, but we're seeing growing numbers of people, and as you mentioned, young women who have not smoked that are being diagnosed with lung cancer. How do you, navigate your way through that, because it throws out lots of confusion to the public?
It does. So despite the fact that there are young women never smokers who come down with lung cancer, by far and away though, the vast majority of lung cancers are in fact due to smoking, about 85% or so. And so by far and away, we do not want to diminish that message in any way, shape, or form. Clearly, smoking is a bad thing in terms of lung cancer, and so we have to, the biggest thing we can do is to prevent lung cancer by having patients not smoke. Having said that, however, even if you took away all the lung cancers due to smoking, lung cancer in never smokers would be about the 7th most common cause of cancer. In never smokers. It would be more common than ovarian cancer or leukemia. Lung cancer in never smokers. So I think it's a two-pronged attack, frankly. I think we have to learn, I think the biology of the disease is different in patients who smoke compared to patients who haven't smoked. And we owe our patients that to find out for both of those patient populations what's driving the disease and the best way to treat it.
What about predictive factors and where we're going in personalized medicine, from not only predictive factors, but in the way we tailor and treat the disease?
Women never smokers is a perfect example, I think, of how we may start to apply personalized medicine. Because as it turns out, that some patients with lung cancer have a mutation in a specific type of receptor called EGFR, stands for epidermal growth factor receptor. And it turns out that if a lung cancer cell has a mutation in this receptor, it can cause a cascade of downstream events once the receptor gets activated. It starts a chain reaction, a molecular chain reaction, which ends up driving the cancer cell, making it grow faster and more, and duplicate more often and in a more malignant fashion. And for reasons that we are not sure about at this point, those EGFR mutations are found most often in, guess what, young women who've never smoked. And again, we don't know why. But it's a perfect example of how if someone has an EGFR mutation for the first time, we are now able to start to personalize their therapy. And rather perhaps than give them cytotoxic chemotherapy, to start giving them a drug which will deliberately target that abnormality in their cancer cells.
It's so important, and I don't know unless someone is diagnosed that they really begin to think about, look how different everything is. I'm a multiple time survivor going way back, even before there were supportive care drugs, where everything was chemically based, chemotherapy, systemically based. Today, the whole molecular component, the way we look at a cancer, the way we look at what's happening on the mutation level, our individual cells, what are we expressing or overexpressing, and then that our therapies are designed to respond to that element and manipulating cancer cells biologically. That is such a magnificent shift.
It is. It's fascinating, isn't it? It really is. And when I looked at the ASCO agenda and look at just the titles of all the things going on in lung cancer, it almost reads like a biochemistry text.
What also struck me this year in looking at the ASCO presentations is the volume in the area of lung cancer.
Yes, yes.
And that's a shift from, if you think back 15, 20 years ago, the hopelessness and helplessness.
Exactly. And it's such a necessary shift because lung cancer is by far and away the biggest cancer killer in America and the biggest cancer killer in the world. And I think it is just now finally starting to get the attention it deserves.
It's very early in the ASCO meeting. We still have days to go. But the big buzz, or as you look around, what excites you the most, or what do you think is really the hot lung cancer button for this year?
I think this year is going to be the fact that they have now identified a second mutation in addition to EGFR, but this abnormality, it's not quite a mutation, it's an abnormality called EML4 ALK. We all call it ALK. And it too is an abnormality, as it turns out, that is found primarily in never smokers. And there is now a new drug for it. And that's what we're going to hear about later this week. And there's a lot of buzz about that. Because again, it's just a perfect example of personalized medicine and how what we're learning we can finally start translating into people.